This is the AM News. Let's get into the details now. Executive Director of the Economic and Organized Crime Office, Madam Yara is advocating for a unified front from stakeholders, especially anti-graft institutions, to combat corruption in Ghana. Madam Tiwa is worried about Ghana's poor performance on the Corruption Perception Index, despite local and interventional measures being instituted by government.
Ghana scored 43 out of a possible 100, having scored the same marks for the fourth year running. The stagnant position has left many anti-corruption institutions and crusaders worried. Speaking at the 2024 Annual Controller and Accountant General Department's Conference, Executive Director of EOCO, Yara was skeptical about the country's progress in the corruption fight.
On Tuesday, the annual ritual of launching the Corruption Perception Index happened at the Nat Hall. And again, Ghana has become stagnant, 43 for 4 years. This is worrying in spite of the numerous interventions that have been put in place by government. We need to be passionate about what we do, passionate about getting results. At the end of the day, what you do, how is it going to improve the fight against corruption? How is it going to make the fight against corruption bad? So we need to identify the things that we have to do to help everybody, because I know that since corruption is done by human beings, it will take human beings to fight it. All hands will be on deck so that next year we'll have improvement in the Corruption Perception Index.
Dubbed Enhancing Economic Growth Through Innovation and Adaptation, the Annual Controller and Accountant General's Department Conference brought together financiers and public officers from municipal, metropolitan and district assemblies. It is to help stakeholders adapt to technology to salvage the sinking economy. Kwesi Kwenin Bosompim is the Controller and Accountant General of Ghana.
Innovation is the driving force behind progress. We must constantly seek new and creative ways to improve our processes, systems, and services. We should embrace emerging technologies and harness their potentials to streamline operations, enhance efficiencies, and improve the quality of financial reporting. Whether it is adopting blockchain technology for secure and transparent transactions, implementing artificial intelligence for data analysis, or leveraging cloud computing for efficient storage and retrieval of financial information.
The department has over the years adopted technologies to enhance operations, including the linkage of the NIA database and Government of Ghana payroll. Ashanti Regional Minister Simon Osei-Mensah, in a speech read for the Vice President, urged the accountants to embrace more technological innovations for improved economic gains.
I also lined the linkage of the NIA database to the Ghana government payroll. The linkage is to establish an unbreakable bond between an individual's identity and their presence on the payroll to identify and eliminate discrepancies or irregularities, ensuring that only genuine employees will receive their rightful remuneration.
For JoyNews, my name is Emmanuel Bright-Kweku.
Now, some political scientists are pushing for more efforts on the part of government to depoliticize the country's institutions. According to the scientists, politicizing institutions, coupled with many appointments made on political lines, have contributed to the challenges in the economy. Political science lecturer at the University of Ghana, Professor Joseph Achuaye, has been speaking at a colloquium at the University of Education, Winneba. There's more in this report.
Speaking at a colloquium organized by the Department of Political Science Education at the University of Education, Winneba, titled Politics Amidst Global Uncertainties, Options for Building a Resilient Society, Professor Joseph Achuaye called on government to improve governance to save the country. According to him, partisan politics has taken a better part of the country, and this is having an adverse impact on the country's resources and the general growth of the economy.
But I think in terms of robustness, we should also be talking about robustness, putting in place structures, putting in place strategies which will enable us to, survive future pandemics, future dislocations, distortions, what have you. We should be able to put in place short-term measures. And one of the things that I would like to flag is the issue of making our institutions stronger. Our institutions at all levels, at the local level, at the regional level, at the national level, the institutions are weak. We need to actually try as much as possible to make our institutions stronger. And this can be done if we depoliticize the appointment procedure into these institutions. I think we have not been able to move away from the politicization of appointing people to institutions. The earlier debate, that is a short, because we are talking about robustness now. And so talking about robustness, we need to put in place such measures. And this can be done. It looks like governments are interested in more or less politicizing almost all institutions. The time has come as a country, if we want to build robustness, if we want to build resilience, the time has come to us to actually deal with, appoint competent people, even though within your party you can have competent people. There may be people who are more competent than the ones that you are selecting. So these are some of the issues that I would like us to deal with in the short term.
He wants the Electoral Commission to embark on a massive education ahead of this year's elections.
This while, we have been having indelible ink. If you want to change, it needs education. Right from the last four, I think education should have started about 4 years ago. Not get up and say we want to change indelible ink at district level elections. It can't work. The stakeholders, you see, because of the contentious nature of elections, you need to get buy-in from all the stakeholders, particularly the major ones.
Director at the Center for Conflict, Human Rights and Peace Studies at the University of Education, Winneba, Professor Zuri David Naya says the uncertainties across the globe call for some reflection so as to build resilient systems to absorb such shocks.
Uncertainties are not going to stop happening anytime soon. But their influences are so phenomenal in our lives. And so what is required of us is to prepare ourselves to be in a position to cope with them. The management of the University of Education, Winneba, is therefore excited that the university, through the Political Science Education Department, is leading us to be empowered to deal with uncertainties by exploring options for building a resilient Ghanaian society.
A medical director of the Upper West Regional Hospital, Dr. Robert Amishia, has disclosed that his outfit is seriously working to set up a center for the treatment of childhood cancers. Speaking after a two-day training workshop on treatment of childhood cancers at the hospital, he noted that one major barrier to the delivery of quality healthcare in the country is distance to healthcare facilities. Rafiq Salam reports from WA.
One major health condition that health practitioners in the country has been grappling with is childhood cancer. Though there is no available statistics to this medical condition, it is not uncommon to see many children with the condition at various health facilities seeking for treatment. It is a global phenomenon, according to a pediatric oncology nurse at the Community Teaching Hospital, Baturi Conrad. He said many are unaware of the disease, coupled with the myths and misconceptions that children cannot get cancer, hence the need to organize a training workshop for staff of the Upper West Regional Hospital. Baturo Conrad opined that cases of the disease is now widespread and there is therefore the need to take prudent measures to tackle it before the situation gets out of hand.
All over the world, there are myths and misconceptions about cancers, where people think that children cannot get cancers, and when a child gets cancer, that child is a witch. or it's a bad omen for the family. So, but I just want to throw, more light on these things so that people can come to the understanding that childhood cancers are real. It's becoming common nowadays. So it's only prudent that we take measures now, because whether we like it or not, childhood cancers have come to stay with us, and it's part of us. So we need to take measures, okay, to mitigate or to identify these cancers early, so that early treatment can commence, because early treatment, early identification and treatment of these cancers leads to good prognosis. However, when they come in an advanced stage, where they come, advanced stage here means that the cancer have already spread to other parts of the body. At that point, the treatment becomes very difficult.
The participants were taken through several topics on cancers. Their focus, however, was on the early warning signals, which you will want the participants to take seriously.
One of them is having a white spot in the eye, what we call leukocoria, okay, or cat-like eye or torch-like eye. When you see a child with a torch with the eye looking like a torch, okay, or that of a cat, normally in the middle of the eye, in the retina, it's telling you that this child could have what, cancer. A child complains of bone pain, okay, always complain of bone pain, you should be thinking cancer. So we have something we call CCC, which is considered childhood cancer. So when you see some of these signs and symptoms, you have to consider childhood cancer. Okay, some of them, the cancer that affects the brain, the child has what, early morning vomiting, okay, because there's pressure on the brain. Okay, the child who has easy bruising, some of them when they brush their teeth, with just a little pressure on the gums, they begin to bleed.
Medical director of the Upper West Regional Hospital, Dr. Robert Amasia, disclosed that the training embarked on forms part of preparation to set up a cancer treatment center at the hospital.
One of the barriers to treatment is distance. So usually, sometimes you refer people to go to Kumasi. Some don't have relatives there. Even if they have relatives there, they need to go accompanied by other people. So it gets difficult. They go for one cycle of treatment, then go for another cycle of treatment, then they stop. And usually, if you don't complete the treatment, you don't get the full benefit. But if we have a center very close to our people here, the likelihood that compliance to treatment will be very high is what we are looking at. So we think that we should start a center here and bring the services very close to our people.
The training program is being funded by a UK-based organization, World Child Cancer, which has been in existence since 2007. Sef Kanekure is its monitoring and evaluation specialist.
We have been getting a lot of referral cases per our data from the Upper West. And then last year we signed a pact or MOU with Ghana Health Service. And since our regional hospital is also under Ghana Health Service, we came here to also build the capacity of the staff for the early detection. And when a child is also diagnosed with childhood cancer, what the staff should also know and provide the needed care. For what child cancer, when we started, I can say that we have been able to support over 1,000 healthcare providers, or let me say healthcare workers, as far as training is concerned across the whole country. And then also World Child Cancer also provide both financial support and emotional support to parents.
Reporting for JoyNews, Rafik Salam. Wow.
From Wa, let me take you now to the Bono East region, where patients seeking specialist-level obstetrics, gynecology, pediatrics, and surgical treatment in the Bono East region no longer need to travel to Kumasi and Accra for such specialist medical care. This is because the Holy Family Hospital in Techiman, upon attaining Safe Care Level 4 certification, has been fully accredited health facility regulatory agency as a secondary-level health facility in the Bono East region. The facility has also been accredited by the College of Physicians and Surgeons as a center for specialist care and training of health professionals, contributing to critical human resource development for the country's health sector. There's more in the following report.
Since its establishment in 1954 by medical missionaries as a health post, The Holy Family Hospital has transitioned within the last 70 years to become a center of excellence in health care delivery. Having attained a Safe Care Level 4 certification, the hospital now delivers international standardized quality care for patients. This certification by Safe Care under the auspices of Farm Access Ghana has helped the facility to improve on key quality standards and protocols, which positioned the Holy Family Hospital to merit the upgrade by the College of Physicians and Surgeons after a rigorous assessment. Christopher Akambonab is the hospital's administrator.
The recognition of Holy Family Catholic Hospital as a training center for residents, resident doctors, both for membership and fellowship, is entirely the vision of the Ghana College of Physicians and Surgeons. One way to improve this current situation would be to decentralize residency training to major regional centers who have the capacity to offer opportunity for more candidates who will not have to move from their social settings to Kumasi and Accra, where mostly residents are currently trained.
Christopher Akambonab assures that beyond its current status as a Level 4 rated safe care facility, the hospital administration is poised to maintain its standards and improve upon its services to become a Level 5 safe care rated facility.
We currently have accreditation for training in obstetric and gynecology, pediatrics, and surgery. This is an opportunity to contribute to critical human resource development for the health sector of our country, and we are honored to be part of it. Level 4 out of a maximum of 5 means that we have one more step to go. And so yes, whilst we are honored to be rated at this level, we still recognize that there's a lot more work to be done. First, to maintain this current rating, and more importantly, to improve upon it and get the highest possible, which is level 5. And we are working towards that.
The Executive Director of the Christian Health Association of Ghana, CHAG, Dr. Peter Yeboah, however, describes the upgrade of the Holy Family Hospital as monumental, paving the way for the training of more health professionals to address healthcare inequities in the northern zone of the country.
To us, it is not only monumental, it is so much a vital instrument of training specialists at the peripheral level, meaning that we are able to attract and retain specialists who will be trained as part of localization and decentralization to ensure that quality health services are spread to the peripheral end.
The current status of the facility as a referral center makes it the first CHAG hospital to be accredited by the college to train specialists in pediatrics, obstetrics and gynecology, and internal medicine surgery. He says this gives meaning to the decentralization policy of the College of Physicians and Surgeons and aligns very well with Ghana's quest to achieve universal health coverage.
The concept of decentralization, the training of members of the college as well as fellows has been one objective of Ghana College of Physicians and Surgeons. Thankfully, after several assessments and follow-ups, the Holy Family Hospital was accredited by the college to train fellows.
Carlos Galoni, JoyNews.
Now to our election headquarters, some delegates in the Yendi constituency in the northern region are asking leadership of the governing New Patriotic Party to rerun the Yendi parliamentary primaries. The delegates warn they will disassociate themselves from the party if this isn't done. The delegates said this at a news conference in Yendi. Martina Bugri has the rest of the story.
The New Patriotic Party held its elections on the 27th of January in constituencies with sitting members of parliament to elect their candidates. The Yendi contest ended in a stalemate after a supporter of Abibata Shani Mahama accused an easy officer of spoiling her ballots. The party's third vice national chair, Alhaji Osman, later declared the incumbent member of parliament for Yendi, Farouk Aliu Mahama, as winner of the contest. But his contender, Aji Abibata Shani Mahama Zakaria, has declared she would not accept the verdict. Addressing a press conference in Yendi, Nindo Abdullahi, who led a group of delegates, called for a rerun considering that the EC did not declare the results per the guidelines of the elections.
The purported declaration of Alhaji Farouk by the National Third Vice Chairman, Alhaji Masoud Osman. This is in contravention of the election protocols issued by the party to guide the election. Please, I read out 2 guidelines of the elections. 1. The Electoral Commission of Ghana shall supervise the conduct of the elections and shall have the full responsibility of ensuring transparent, free, and fair election. 2. No person, whether a government appointee, party official, or otherwise, shall act in contravention of the Electoral Commission and these guidelines. So why in this case it was Alhaji Masahudu who declared Alhaji Farouk Aliyu Mama as the winner of the election.
He also wondered why the Northern Regional Police Commander and EC officers from Tamale and elsewhere were in the forefront of the elections instead of the Yendi team that had previously held the elections.
The Electoral Commission brought their directors from for Saboba and Kandai, a deputy director of Sanargo, a regional technician, and a regional storekeeper to augment the EC team from Yendi. Meanwhile, in all previous elections, it is the Yendi team that conducts elections, including the recently held presidential primaries. When it was time for sorting and counting, the Yendi Municipal EC Director was not found in the scene. From the media, another issue of concern was when the Yendi Divisional Police Commander was directed by the Regional Police Commander to take care of the gate, while he, the Regional Commander, took over the elections. This, in our view, was needless. The Divisional Command has always lived up to expectation when it comes to elections in Yendi.
Mr. Nindo alleged that Ajia Abiba Tashani Mahama was being treated unfairly because she's a woman.
In all of this, Ajia Abiba Tashani Mahama Zakaria has been treated unfairly because of the stereotype they have placed on Yendi that a woman cannot lead Yendi. Isn't this a backward thinking in this 21st century? Even as a CEO, she has performed creditably well in areas of human resource development than the current member of parliament. What men can do, women can do better. We therefore call on civil society organizations, CSOs, and gender activists to join this call to fight this injustice.
Some of the delegates spoke to the media after the press conference.
No, we've been hearing that Alhaji Farouk has been nominated as a candidate for Yendi. No, we delegates are saying that no, we didn't elect anybody unless we do rerun. If Alhaji Farouk wins, fair enough, we are following him. If Ajia Abiatal wins, fair enough. But if they take their own decision, like picking one candidate as the winner, no, we delegates, we are withdrawing our hands out of the party. This is what we mean.
But what we want is that we want re-election. Because what happened that day, I was there. It's not that somebody told me, I was there. I was at where they were counting the ballot papers. But what happened there, it is very obvious. It's very obvious. Since we started this party, we've never seen that before.
Indeed, what the men can do, women can do better. Hopefully they resolve that. Now, Yara Ghana has rewarded its retailers who use the Yara Connect app to sell their products. The app is to help the company track how its products are being purchased. Martina Bugri reports.
Yara Connect, a digital app, aims at helping retailers offer farmers advice and to help them make input purchase decisions. The app, which is also a loyalty program for retailers, is for them to earn reward for purchase made on Yara fertilizer products. Speaking at an event to reward retailers who had accumulated points using the app, Yara sales agronomist for the Eastern Corridor, Muhammad Abdul Rahman, said it was the first step to the company's digitalization drive.
This is just the first step towards going fully digital in our business. By scanning, certain basic data is gathered. And to do digitalization, as we always say, what we need is data. So this app is to enable us try something very basic to get data to understand the dynamics of where our products are reaching or spreading to. And by supporting us to do it, you, the retailers, stand a chance of getting something in return.
The Digital Value Chain Solutions Manager, Kwame Abochie, said Yara Connect has helped bridge the gap between the company and its retailers.
Now, you will realize that typically our engagement with the distribution chain is more close with the distributors. But then the retailers are the last mile to reach the farmers. And we wanted to improve that connectivity. And so the app was launched not only to connect Yara to its retailers, but also to run a loyalty program for our retailers.
The managing director for Yara Ghana Limited, Teresa Randolph, said, considering that the country is moving digital, there was the need for them to join the drive.
Moving into a digitalization economy, Yara also felt it was important to strengthen our connection with these last mile retailers in the distribution chain. And therefore, as a part of the digital value chain offerings, we introduced an application-based loyalty program, which we called Yara Connect, for our retailers. And at the same time, we also incentivize them to help to create loyalty to the Yara brand. This gave birth to what we call Yara Connect, which is the app available on the Apple and Google Play Store. And all our retailers were welcome to download this and use it to scan the QR codes that are on our Yara fertilizer bags and accumulate points so that they can gain rewards throughout the program.
And that's how we wrap up for AM News on the AM Show. My name is Sweetie Abochie, and I do this with Benjamin Akapo. Do not go anywhere. The news review is up next, but you particularly want to stay for Benjamin Akapo's blunt thoughts later on in the show. My name is Sweetie Abochie. Keep watching.